ServSafe Module 1 Review, providing safe food, etc. Surfaces and utensils must be washed, rinsed, and sanitized between uses. Wiping cloths may not cut it, especially if they are not stored in sanitizer between uses. What are the 5 things to focus on to keep food safe? Control time and temp, prevent contamination, practice good hygiene, purchase from approved suppliers, clean and sanitize. When pathogens transfer from one surface to another, we call it underscore 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 dash underscore 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 underscore. Raw food added to ready, no further cooking, or when contaminated touches ready to eat. What can be an issue with cleaning cloths? Cross-contamination. Contaminated cloths can touch food surfaces and contaminate them. Who is at higher risk for foodborne illnesses? 6. Elderly, those with compromised immune systems, preschool children, HIV/AIDS patients, transplant recipients, those taking certain medications. State and local regulatory authorities regulate retained food service operations, which may differ from the underscore 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 underscore. They also enforce regulations and investigate underscore 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 or underscore 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 underscore. What do they issue? FDA Food Code, since they're not required to use it, complaints, illnesses, licenses and permits, and approved plans. Name the 3 categories of contaminants. Which is most common? Biological, chemical, physical, fish bones, biological. Presence of Certified Food Protection Manager is linked to lower risk of foodborne illness outbreak. Okay. FDA Food Code requires that someone in charge be a underscore 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 manager, on-site at required times, depends on operation and type of food served, show you have required knowledge, pass this test accredited program. Certified Food Service. FDA inspects all food except for which 3? They also regulate food that is transported across underscore 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 underscore. The FDA issues the FDA Food Code, as well. Meat, poultry, eggs. State lines. List the 5 common risk factors for unsafe food. What are the 4 categories of hazard that these fall under? 1. Unsafe sources, private home. 2. Cooking incorrectly. 3. Holding at wrong temp. 4. Contaminated equipment. 5. Poor personal hygiene. Poor personal hygiene, poor cleaning, time temp control, cross-contamination. Which agency is responsible for inspecting meat, poultry, and eggs? What other thing does this agency do? What agency researches the causes of foodborne illness outbreaks? Which group writes/adopts codes to regulate retail and food service operations? USDA regulates food that crosses state boundaries. CDC, PHC2, state and local regulatory authorities. Staff should be trained right away, then it should be ongoing. Document as soon as it's done. Corrective action should also be practiced. What is this? See employee making mistake, correct it. A foodborne illness is a disease transmitted to people through food. There are underscore 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 of cases each year, have been declining recently. To confirm an outbreak, underscore 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 or more people must have the same symptoms after eating. Who then conducts the investigation? A laboratory analysis then confirms the outbreak. Millions to the same food state or local regulatory authorities. One foodborne illness outbreak can cost thousands of dollars and even do what to a business? List 3 more consequences of a foodborne illness outbreak. Shut it down, staff morale lower / retraining needed, negative reputation, loss of customers. List 8 challenges to upholding food safety standards. Literacy and education levels, language barriers, different customs, time, pathogens, getting more frequent, unapproved suppliers, high-risk and elderly customers, staff turnover / training. Ready-to-eat food examples, washed fruit, whole / cut, pastry items, sugar, spices, bread. Okay. Underscore 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 dash underscore 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 results if food is left sitting long enough to allow pathogens to grow. This can happen if food is stored at the wrong temp. It isn't underscore 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 long enough, or is cooled down underscore 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 underscore. Time temperature abuse cooked incorrectly. The FDA Food Code is science-based and provides guidelines for food safety regulations, required internal cooking temps, etc. Created for city, country, state agencies, which regulate things such as restaurants, underscore 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 underscore, and more. Is this a law? Daycares, hospitals, no, recommended but not required. TCS stands for foods that are classified as this often grow pathogens most easily. Meat, potatoes, tofu / soy, cut fruits or veggies, untreated garlic / oil mixtures, dairy, eggs, cooked veggies / fruits. Time and temperature control for safety. What is the most common cause of unsafe food? Contamination, presence of harmful substances in food. List 4 ways that poor personal hygiene can lead to contamination. Touching wound and food, sneezing on food, working while sick, not washing hands after bathroom.